Hi, my name is Mi-kaisha and I'm a singer-songwriter from Sydney, Australia, and I'm also a proud Darumbal Tongan woman. I would like to acknowledge the traditional owners of the land on which we meet today, and wherever you may be watching this video from, I would like to acknowledge that you are also on Aboriginal land. I acknowledge Indigenous peoples' continuing connection to culture and country, and may our dreaming spirits continue to protect us as they have done so for tens of thousands of years through challenging times such as now and through many pandemics. Thank you for joining us for another information video about COVID-19. This information is designed to help all children and young people in New South Wales navigate their way through this pandemic with the latest factual information. Everyone in New South Wales has made major changes to their life as a result of COVID-19. And in these uncertain times, it is important to ensure that we all monitor and follow advice from reliable and reputable sources. We are lucky to be able to get our information directly from the New South Wales Chief Medical Officer, who plays a central role in directing our state's health response to this pandemic. Dr Chant, we know that you're one of the busiest people in New South Wales at the moment, so thank you for taking the time to answer some questions. Firstly, since our last video with children and young people, there have been some very significant changes to the public health orders in New South Wales. Can you please outline what has changed?
That's a very good starting question, and I think it's important to say that we're in a process of change. So at the moment, we've suppressed community transmission. That gives us some comfort. We know that we've got to continue to monitor that closely. But what we're now doing is easing restrictions more broadly. So it's about putting a COVID lens on everything we do to allow business to open up, but to do so in a safe way.
With changes being announced, it is hard to know whether we should continue to follow old restrictions. What advice remains the same for children and young people?
So the advice that will stay the same and will be in place for a very long time is advice around not going out and about when you're unwell. So if you've got a cough or runny nose, a fever, don't go out and about, go and get tested. We really need the community at this time to really put themselves forward for testing so that we can jump on any cases of community transmission and block its transmission in the community. The other advice is just that hygiene advice, washing your hands, and I think people have realised now how much they touch their eyes and mouth and how many times they touch surfaces. Washing your hands before you eat, washing your hands and having hand sanitizer with you. That will stand us in good stead this year for COVID, but will also probably reduce a lot of other infections that we manage to transmit through our hands. The other recommendations will be maintain that social distancing. So obviously household groups spend a lot of close time together. But when you're out and about, just maintain that social distancing. Please do still listen to our advice around the size of gatherings, the safe occupancy of venues. We know that the more people that are crammed in tight spaces, the more risk of transmission. Now, obviously it depends on someone being infectious going into that environment, but we do know those environments overall are more risky.
As you know, this has been a really uncertain and difficult time for children and young people. The easing of restrictions appears to be a positive step forward, and I know a lot of people want to know, have we already seen the worst of the virus? There are murmurs of a second wave now that students have returned to school. Is this likely to happen?
So let me address that in bits. Students returning to school is not likely to significantly raise the risk. What we're very conscious of is that associated with the students travelling, there's a lot more activity for parents and adults, and we've certainly been advising around how to return to school in a COVID-safe environment. What we are concerned about now is that we have cases in the community that are undiagnosed, and that's because the disease is mild, not everyone comes to medical attention. That's why at the moment it really needs to be a partnership with the community. If we can get the community to come forward and get tested even with mild symptoms, it gives us a great degree of assurance that we're not missing spread in the community. And it's like all we know is what we know about the current situation, and it will only be in 2 to 4 weeks' time where I can say, actually, we were in this position at this point in time. And so that's one of the challenges for us. But that doesn't mean that we haven't got undiagnosed infection. It probably could be at low rates. So that means that as we have more people interacting, the potential for spread or interaction between someone who's infected, then in passing that on to a group of people. And the more people that person comes in contact with, the greater the spread potential, because that person might infect 5 others, those individual 5 people might spread it to another 5 people. So the whole concept of the restrictions has been, even if you've been infectious, decreasing your opportunity to actually spread it more in the community. So as we ease restrictions, those opportunities for broader scale transmission are there. So what we've got to do is make sure that we mitigate that by making sure that the way we interact with each other is safer, by maintaining that social distancing, by not going out if you've got symptoms, by getting tested, by washing your hands, and taking those other control measures by business. That will reduce the risk of transmission, but ultimately the question for us that we don't know clearly at the moment is how much disease is actually in the community that is unrecognised at this time.
Have there been any recent developments with a vaccine?
It's pleasing to see that the world is united in attempting to find a vaccine. So the best minds across the world are working day in, day out. We're also concurrently developing manufacturing capabilities should a vaccine come. So this is unheard of in our approach. So usually it takes many, many years for vaccines to be developed. Our current thinking though is that we are not going to have a vaccine for at least another probably 6 to 12 months. And I mean by that vaccine that can be actually injected in someone at scale. So there's a number of trials of vaccines that are being trialled in other parts of the world to look at how effective they are. And the outcomes of those will be known later in the year. And then the challenge of then scaling up production, should some of those be effective, will come into play. The fact that everyone across the world is trying so hard, and the fact that we've progressed to clinical trials of a number of vaccines, does give me hope that we will see a vaccine. But if I had to put my best guess on, it will be in the second half of 2021 before we have vaccines to roll out at scale.
Dr. Chant, does this particular virus evolve like the flu? Will this continue to be an ongoing battle like the flu?
My best guess at this time is yes, it will continue to be with us into the future. It will potentially be like other human coronaviruses, something we have to endure permanently. Part of the issues for us considering will be the effectiveness of the vaccine, how long the vaccine gives us immunity, and that will sort of, I suppose, give us an indication of how troublesome this will be into future years. But that would be our thinking at this time. Relatively speaking, we've only had a short experience with this virus. It's only been the 6 months. Clearly, it's probably too early to tell how it will evolve over longer periods of time. We certainly can see different patterns in the genetic makeup of the virus depending on where it's originated from or which countries travellers have returned from. They've still got slight changes. The question will be will that be material, and will it continue to evolve and change in a way that makes vaccination more challenging? And we don't know that at this moment.
We're hearing a lot about testing for COVID-19. Why is testing so important?
COVID-19 is a pretty tricky disease, and that's because for many it's actually quite mild, and for some it's quite severe. The difficulty we've got is that we know that people with even mild disease can then transmit it. So unless people are coming forward to testing, one, we don't know how much disease we've got in the community. And if people don't come forward, we can't track down those chains of transmission and we can't prevent ongoing spread. One of the strengths of our response has been that contact tracing, the ability to test people the fact that the community has come forward in numbers to get tested has allowed us to track down chains of transmission and prevent that spread in the community.
If a child or young person is feeling unwell, what is your advice? And what advice do you have for their parents or carers?
So at this time, I think even young people and their parents will be very familiar with the symptoms of COVID. The sore throat, the runny nose, the cough, the fever. If you or your child has any of those symptoms, then it's important to get tested. It's important, as I said, so that we can identify cases and we can block transmission, but also understand how that person potentially acquired the infection.
We're also hearing a lot about the importance of physically distancing. With restrictions easing, is this something that we should still be doing and following?
We're still recommending that people physically distance whenever they can. And the rationale for that is that if people around them are coughing or sneezing, and they may be pre-symptomatic, they may not have symptoms at that time, if they're singing, shouting or other things around them, then potentially that 1.5 metre barrier gives that added protection and removes the risk for that other person of acquiring the disease.
If children and young people aren't required to physically distance at school, is it still recommended that they continue to physically distance when they're out in public?
Yes, it is. Clearly, the risk of COVID disease, and it seems to behave differently across the age spectrum. So as you're moving into adulthood and you're out independently, we clearly recommend that you're still maintaining the physical distancing. And the rationale there is that at school we actually know who you're with, but out and about we don't know who you're interacting with. And so there is a layer of controls in schools that aren't in place when you're going out and about.
I know that many families may be having lots of relatives live in the same home. What do you recommend for people in these situations to stay safe when they can't physically distance at home?
Just some of those basic measures, and we recognise that in a family household it's really hard to sustain social distancing. That isn't how families operate. What we're probably recommending here is that if any member of the family gets unwell, that you promptly get a test. And then if that person turns out to be positive, you've got an opportunity to intervene and for that person to maybe isolate themselves or to go to another house or a setting where they're able to keep away from people if there's a large number of people in your house or circumstance. We're also suggesting those simple things like covering your cough, tissues, discarding them, the hand hygiene, so the regular hygiene measures. But we know the challenges in a household, and that's why, particularly as we're allowing more visitors into your house, we're conscious of making sure that you're messaging to visitors that it's okay not to come and visit if you've got symptoms, and that we're not going to take any disrespect from that. Please, we prefer that you stay away. And thinking about environments where if you have got an elderly person or someone who's very sick with underlying health conditions, visiting them or seeing them or entertaining them in outdoor environments is often safer, because we know the indoor environments are more risky than outdoor environments.
We know that the elderly and rural Aboriginal communities may be more susceptible to the virus. Are there any other groups of people that may be particularly at risk, and how can we help them?
So you've correctly identified the fact that elderly people or those with underlying health conditions, things that reduce the immune system, so people that might be having chemotherapy, people with chronic heart or lung diseases, people with diabetes. These are all factors that increase people's risk of not necessarily acquiring the infection, but having a more severe course of illness.
We know that the virus can have a great effect on our physical health, but can we talk just a little bit about what kind of impact it has on our mental health? For Aboriginal and Torres Strait Islander youth, our connections to each other socially and culturally play a very big role in our mental and physical health. What resources around keeping ourselves healthy mentally and physically are available for young people right now?
First of all, I'd like to acknowledge the impact for everyone in terms of the mental health aspects. I think it's been a very trying for young people and all people in the community. It can be very frightening and confronting, the images we're seeing around intensive care and the numbers that are being reported from around the world, and I can really acknowledge that. Also being isolated and some of the things that we're asking people to do actually break some of their normal patterns of engagement. So I just wanted to thank everyone for coming on the journey, and the ability of the community and young people as part of that to abide by some of those restrictions has really contributed to us being where we are at the moment. In terms of the resources, I know that the Aboriginal Health Branch has developed a number of resources in conjunction with the AH and MRC that are aimed at speaking particularly to Aboriginal communities, but there is also a lot of work around youth-focused information. And I acknowledge the work of the Youth Advocate and others in trying to get some of that information in a user-friendly way. And Mi-kaisha, it's now my turn, and I suppose I'd just like to start by saying, what have you found personally most challenging, and what would your message be to young people having reflected on those challenges?
Yeah, like I said before, being a young person and being a young Indigenous woman, so much of my mental health has to do with connections to community and being connected with family and just meeting people on the street. You know, like these are simple things that have been taken away from us. But honestly, having social media and being able to still stay in touch with people has been a major blessing. And I'm very grateful that we're in, you know, a time where I can stay connected with family in Sydney, in Rockhampton, in New York. Like, this is something that in previous times people didn't have the privilege of. Other than that, I've just been writing music, reading books, taking time just to be still and not have the craziness of the world. You know, like, I don't have to be connected to the world so much.
So that's probably been, it's been interesting that some families have really responded to the time of having more time with their children than previously.
Yeah.
So I think there's many things that out of COVID we need to draw and distill the things that have worked well for us, brought us closer together.
Yeah.
And I think as a community there's been a strong sense of community strength that we need to reflect on and I think acknowledge.
Yeah. Thank you so much, Dr. Chant, for answering our questions today.
It's been a pleasure. Thank you.
Remember that during this pandemic, it is so important to make sure that you're listening to reputable sources. If you would like more information about the virus, visit the New South Wales Government website, nsw.gov.au. If you feel unwell, it is important to tell someone and speak to Health Direct or a registered GP for health advice. It is normal to feel anxious or upset by COVID-19. If you have been affected by the contents of this video and would like to talk to someone who can help you, please contact one of the organisations on the screen who can offer free counselling advice. Thank you for watching this video, and thank you again to Dr. Chant for taking time to answer our questions.